Welcome to The Explainer. Today we're breaking down a huge shift in medical tech, and we're going to do it by looking at something you've probably never thought about: the software running in your eye doctor's office.
Alright, so let's start with the question that, honestly, feels a little weird to ask. With all the amazing tech we have today, why is a job like your eye doctor's actually getting harder?
Well, the document we're looking at today says it's basically a perfect storm. On one hand, doctors are dealing with more complex, long-term diseases like glaucoma than ever before. And on the other hand, the tools they use, those super high-def pictures of your retina, scans that map out every single layer of your eye, are generating this absolute flood of data for every patient. It's not just a lot of data, it's a full-on tsunami.
So you've got these super complex cases and this mountain of data. It's a pretty high-stakes situation, right? Our source material actually breaks this down into 4 core problems that eye clinics are facing today.
Okay, so first up is that data overload we talked about. The problem is, critical images are often stuck in different digital silos. They don't talk to each other. It's like trying to build a puzzle, but all the pieces are locked in different boxes in different rooms. Then you've got the insane amount of time they spend just on paperwork. On top of that, you're trying to manage these chronic conditions over years, and to top it all off, you have to find a way to keep patients actively involved in their own treatment. It's a lot.
So what's causing all this chaos? You might think it's the lack of tech, but the document argues it's the exact opposite. It's the wrong kind of tech. The real villain here is generic one-size-fits-all software, stuff that was just never ever built for the super specific world of eye care.
And this just nails the core problem, doesn't it? You have these highly trained specialists being forced to use these clunky, general tools for a very, very specific job. It's a classic square peg and a round hole situation. And the result isn't just things being slow. The source is clear. This leads directly to doctor burnout, and that, of course, impacts the care that every single one of us gets.
Okay, get ready for this, because this slide really shows you what we're talking about. Let's start with imaging. On the left, that's the generic chaos. You're manually uploading files, you can't even draw on an image to show a patient what you're seeing, and the files are just everywhere. Now look at the right. This is the specialized world. One click, the image is captured, you can draw right on it, and boom, it's instantly in the patient's chart. It is literally night and day.
And it doesn't stop there. Take a look at the operating room, a super high-pressure environment. The generic system, you get basic forms, paper consent forms, so much paper. But the specialized system, it's got things like surgeon preference cards built right in, digital consents, and a clean, single-screen workflow for taking notes. It really is the difference between running an obstacle course and just walking down a clear path.
Now this next one is absolutely critical, especially for tracking those long-term diseases we mentioned. In the generic world, a doctor has to sit there and manually build graphs to see if a condition is getting worse. Can you imagine? But with a specialized system, they get these automated dashboards that crunch the numbers, analyze trends over years, and can even use AI to flag a problem before it becomes a full-blown crisis. That is a game changer.
Okay, so when you see those comparisons side by side, the solution becomes pretty obvious, right? The material we're digging into makes it clear. This isn't about slapping a few patches on the old, broken system. It's about a total switch to a platform built from the ground up just for eyes. And, according to the source, making that switch brings 5 big, proven benefits. We're talking better clinical decisions, way faster workflows, much stronger patient engagement, a healthier bottom line with lower costs, and the power to grow based on actual data. And here's the key thing to remember. This isn't just a generic electronic health record or EHR with a few eye care features tacked on. No way. A true specialty-specific system is a totally different animal. It was designed from its very first line of code to speak the unique language of ophthalmology.
But look, features and benefits are great on paper. What does this actually mean in the real world? This is where it gets really interesting, because the source material backs this all up with some seriously powerful numbers.
And what's so cool about these numbers is that they're not just about making the clinic run faster. They show a direct, measurable impact on the health of the practice and this is the most important part, on the quality of patient care. First, let's talk speed. Doctors are finishing their exam notes up to 50% faster. 50%! Think about what that means. That's a huge chunk of time they get back. Time they're not staring at a screen but are actually talking to their patients. It means more time for your questions, more time for real human connection. Then there's the money. The document points to a study that found practices can save as much as $188,000 in just 4 years on transcription costs alone. That's a ton of money that can be put right back into the clinic for better equipment or new patient programs. And check this out, this one is huge.
When you have better tools for connecting with patients, things like online portals or automatic appointment reminders, you see a 25% drop in no-shows. That's a massive win-win. Patients get more consistent care, and the clinic runs way more smoothly.
And here's where it all comes together. You add up all those